Today we will discuss allergic rhinitis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Allergic rhinitis, often called hay fever, is a common condition where your immune system reacts to allergens in the air, such as pollen, dust mites, or pet dander. This reaction can cause symptoms like sneezing, runny or stuffy nose, itchy eyes, nose or throat, and watery eyes. How to know if you have allergic rhinitis. Symptoms. Pay attention to the symptoms mentioned above, especially during certain seasons or when you're around pets or dust. Timing. Notice if your symptoms occur at specific times of the year, like spring or fall, or in certain environments, like when cleaning your house. Family history. If you have a family history of allergies, you may be more likely to have allergic rhinitis. Allergy testing. A doctor can perform tests such as skin tests or blood tests to identify specific allergens that trigger your symptoms. If you suspect you have allergic rhinitis, it's a good idea to consult a healthcare professional for an accurate diagnosis and management options. If someone has allergic rhinitis, here are some simple steps to help manage it. Avoid triggers. Stay away from things that cause your allergies, like pollen, dust, or pet fur. Keep indoor air clean. Use air purifiers and keep windows closed during the high pollen seasons. Regularly clean your home to reduce dust. Use saline nasal spray. This can help rinse out allergens from your nose. Take antihistamines. Over-the-counter medicines can relieve symptoms. Check with a doctor if unsure. Consult a doctor. If symptoms are severe or don't improve, see a healthcare professional for advice and possible treatment. So what this is saying is that while this is obviously can be self-medicated type of thing from over-the-counter medicine, maybe if you feel that you still don't have control over your symptoms, you can see a doctor for further consultation. And the last one is to stay hydrated. Drink plenty of water to help your body cope. Taking these steps can help reduce symptoms and make you feel better. In a hospital, if someone has a severe allergic reaction related to allergic rhinitis, here's what the medical staff typically does. Assess symptoms. They check how serious the symptoms are, like difficulty breathing or swelling. They administer medications. They give antihistamines to reduce allergic reactions or corticosteroids to decrease inflammation. They provide oxygen. If the person has trouble breathing, they might give supplemental oxygen to help them breathe better. They use an EpiPen. If the reaction is very severe, anaphylaxis, they might inject epinephrine to quickly reduce symptoms. They monitor vital signs. They keep an eye on heart rate, blood pressure, and breathing to ensure the person stabilizes. And they provide support. They offer comfort and reassurance while treating the symptoms. These steps help manage severe reactions and keep the person safe. Here are some commonly used medications for allergic rhinitis. Antihistamines, that's the drug class. Some examples include loratadine, brand name Claritin, cetirizine, brand name Zyrtec, fexofenadine, brand name Allegra, diphenhydramine, brand name Benadryl, which can cause drowsiness. Nasal corticosteroids such as fluticasone, brand name Flonase, budesonide, brand name Rhinocort, mometasone, brand name Nasonex, or triamcinolone, brand name Nasocort. So obviously those are all steroids. Decongestion such as pseudoephedrine, Sudafed is the brand name, or phenylephrine with brand name Sudafed PE can also be used. And finally, we have the leukotriene receptor antagonist drug class. The example here is Montelukast, brand name Singulair. These meds can help relieve symptoms of allergic rhinitis. It's best to consult a healthcare professional to find the right one for your needs. And people do respond differently to different brands of medications. People at an increased risk of developing allergic rhinitis include family history. If parents or siblings have allergies, you're more likely to have them too. Other allergies. If you have other allergies like food allergies or asthma, you might also develop allergic rhinitis. Living environment. People living in urban areas with more pollution or exposure to allergens like pollen or mold can be at a higher risk. Age. Allergic rhinitis can start in childhood or early adulthood, so younger people may be more prone. Seasonal factors. Those who spend a lot of time outdoors during high pollen seasons may be more likely to experience symptoms. And finally, pets. Being around pets that shed fur or dander can increase your risk. Understanding these factors can help identify who might be more susceptible to allergic rhinitis. Now you need to watch my video on alcohol withdrawal or have a look at benzodiazepine withdrawal.